So to start off this owner's pride and neighbor's envy, before I say that, can you all recognize this iconic image, this iconic ad that used to come in Doordarshan in those old days for Onida TV? So that was their caption for their ad, owner's pride, neighbor's envy. And it's, I think, a very nicely captured topic by Semi today to talk about the newest gadget, apps, and tricks in the emergency department. So I'm Dr. Harshitha Sridhar once again, and we'll go about understanding few things that probably is the future for the emergency department in India. So innovation in the emergency department has always shown to develop the department further. It helps in improved patient care and overall clinical efficiency, and improves the overall outcomes of the patient. So we must look at what new things that we can do in the department. Here are a few of the innovations in these gadgets and apps that I want to talk about today. So the highlights of the topic is going to be handheld devices to wearable biosensors, use of telemedicine and remote monitoring in the emergency department, application of artificial intelligence, augmented and virtual reality uses, and robotics in emergency medicine. I hope these highlights do excite the audience to know further about it, as to can we really use robotics in emergency? What is this augmented reality use? How can we enhance AI? Today we have chat GPT and other things. So what is more about this AI that we're going to talk about? So innovation in the gadgets that are used in the emergency department. This most of us are very familiar about. It is probably used in many of your emergency departments. This is fiber optic scopes and video assisted laryngoscopes that we use for difficult airway management. Those who have frequent complex polytrauma patients or complex intubations that happen very frequently. This is definitely an equipment to have in your department, which can help out in difficult airway management. So I also found this is called the Genesis Airway Innovation. This is where you have an interchangeable endotracheal tube, and you can change between the oral and the nasal endotracheal tube, or do vice versa, instead of avoiding to re-intubate these patients. So if there's a patient who needs an oral procedure, can be intubated through the nasal passage. Once the procedure or the situation is sorted, you can convert this into an oral intubation without having to re-intubate this patient. So this is one of the innovations that we have in airway management. Have you ever, I mean, I'm sure a few of you might have known about it, but it was quite thrilling to understand this robot-assisted intubation system. This was developed by an anesthesia professor by name Thomas McGill, and this is called as Kubler intubation system. This is probably used, I mean, you have an jockey stick, an intubating robot placed on a rack. You have a control system, and this feeding structures is put into the mouth, and the anesthetist or the ER physician can probably stand with the jockey stick and intubate. I probably see the use of it in somebody who are in isolation wards or have some infectious diseases, where we can probably consider for the future robotic intubations, robotic uses for intubations. Of course, now ED is incomplete with ultrasounds. It is now day-to-day activities to identify diagnosis in the patients who are present in any kind of emergencies. So the 21st century stethoscope for the ER physicians has been ultrasound, but there have been further innovations on this. There have been wireless probes with apps that are put into your Android or your iOS phones. They can give you very sharp imaging and accurate and sharp details. And the ultra mobile scanner can pair instantly with your phone. So this is from Claire. You can also have it from GE and Sonosite. Many portable handheld ultrasound machines that we can use today. Point of care test device. Again, many of the hospitals are already starting to use this point of care devices. This has shown significant benefits in patient management, where you're able to get quick results and you're able to settle the patients more quickly. However, with multiple point of care devices that are being generated today and the companies coming to you, I would recommend proper governance policy so that you have a credible and effective and safe practices to your patients. IT clamp, this was also something interesting that I found. This is for immediate hemorrhage control. It's a simple clamp that can seal the wound with minimal pain. The hematoma that gets contained in it actually causes pressure over the injured vessels. It does not harm the injured vessels, or in a sense, it does not damage basically the injured vessels, and it controls the bleeding spot very effectively. This can be used on the scalp, on the arms, and can control the hemorrhage very well. Wearable biosensors, again, this is also something, in fact, one of the conferences when I went, I heard about one Hyderabad doctor who had actually got in touch with one IT specialist, and he himself had brought up a device, which is something like these biosensors, which can be applied on the patients, and they detect these vital monitoring of the patients. They can even detect falls, and this drives early interventions to the patients. So I think the use of it in the emergency, especially when you have a very large ER setup. Today I had been to, I had an opportunity to go to the CMC emergency department, and I was so fascinated seeing that huge setup, but I feel the patients can get lost somewhere. So maybe when you have a large setup, these biosensors in the ED can help you get it on, information just right on your phone or on your system to know what's happening with the patient. Automated dispensing cabinets. This is something that I recommend for better quality use, especially by our emergency department nurses. Today, many things are already electronic in our hospitals. Your patients are all digitally captured informations that you have. So if the doctor has to just prescribe the required medication, it gets entered into the system, and the nurse has to scan that patient's ID or the barcode. And then these are automated dispensing cabinets, which will help. Those specific cabinets will open, and you can have the inventory that is required, the medicines that are required for that particular patient. So this helps nurses who work in these busy emergency departments to maintain their inventories. So this is automated dispensing cabinets that are used mainly in the American setup. Automatic CPR machine. Again, I'm quite sure that many of us are already aware. Many of the emergency departments are probably already using this. With this, that I don't have to even talk about the advantage. Of course, there have been certain people have spoken about its pros and cons, but it's mainly advantages because you can have this used for during the paramedic transfer of patients with ongoing CPR. It can be used in your emergency departments. There is also recent recommendation of having a mild head end elevation while doing it. So this can be used for facilitating the same. Ambulance telemedicine kit. So these are kits that are available, which are Bluetooth connected. So the paramedic who goes in and brings this patient can use these equipments to connect to the patient and check their vitals. And they get spontaneously recorded, and it goes to the remote doctor who can manage this patient, especially for those who have a sick case to be transferred or has a longer distance to transfer this patient. This is basically a telemedicine consult that can happen for all kinds of emergencies during the ambulance ride and can improve an effective patient care to the patient for the care. So drone ambulances, again, we have seen in the US, the drone bringing in the AEDs to the BLS site. You can also carry medicines in it, especially emergency drugs like adrenaline, insulin, dextrose, that can be brought to the site, especially when you're talking about remote areas. But I think I had a session with the traffic police, and I was actually talking to them that in Bangalore, why can't we actually have these drone services which can actually bring in AED to the setup? So hopefully this is the future very soon. Coming to the latest applications in the emergency department, many of us have got into digital records, the electronic medical recording of the patients. What many companies have, the IT companies have brought in is more user-specific digital documentation. You have these clinical decision modules. You enter certain things, and you can have AI associated to it, artificial intelligence, which will have certain protocols set, and you can follow those protocols. It will suggest you the treatment plans. So it can be advanced, and you can play with it and do. You can probably benefit further. The doctor doesn't have to miss the protocols by using these advanced EMR techniques in the emergency department. The artificial intelligence is also commonly known for use in triaging systems, where you can use these specific triage protocols, and instead of manual triage, which takes longer time for the patient to be received and checked by a nursing staff or a triage staff, these auto triages can tag these patients faster, and they can probably be more effective in moving them to the appropriate triage zone. Simulation training and skill assessment in the emergency medicine. SEMI is quite active in promoting simulation training. We recently have an MTLS program with simulation scenarios, with the mannequins with simulation. There have been SimWars in the conferences. So this is, again, something that has to further pick up more so that our trainees can have this facility where you are in a situation where a simulation can be given and you're more sure about how to deal and get yourself trained on. Now with simulation comes also these virtual and augmented reality uses in emergency medicine training. So you can use these apps and have the scenario-based understanding. So you can see in this image that they are basically they have this virtual image around them, and they're trying to pretend to do CPR over there. But you don't have to really spend on a mannequin or do these things, but it gives you kind of a real feeling, an augmented reality feeling of conducting an emergency case scenario. So this is, again, something that we should consider for our future. Augmented reality has also been very prominently used in disaster management. In fact, we have many research articles which are being published more and more about use of AI in disaster management protocols, where you can use this in both pre-emergency preparedness, during the response of an emergency, and post-emergency recovery situations, where AI can facilitate and make us understand better on how we can have these disaster management protocols strengthened. So that was all about the innovations in the gadgets. Now, what are the tricks and applications that I spoke about? Some of the tricks that we can apply in the emergency department is the use of lean principle in the emergency department. Now, this was introduced by the Toyota principles by the Japanese, where they wanted to improve the quality of their care. So they spoke about these defining a value, mapping the value stream, making the process flow, and looking at how the pull is from the customer and work towards perfection. So how does this work in an emergency department? For example, you want to reduce the TAT time in your emergency department. So you define the value. You want to reduce the TAT time for a category, say 1 or 2 or 3 patient. Now you define a value stream, how the patient comes into your department till he gets moved out of your department in terms of admission or discharge. You're making that process flow. You're identifying all the reasons that can actually cause a delay, which can be improved. So you try to look at certain corrective actions, and then you start perfection. You start working towards perfection, and this is how lean principles basically work. So these lean principles help in changing your work designs, your work structures, your work process, and they definitely help in improving the quality and safety of the patient. By doing so, the employees are also motivated, and this also improves the employee condition in the department. So I think today, all the NABH standards, JCI standards, talk about quality in the ER and how you want to maintain your TAT and other things. And for maintaining these quality targets, we can use the lean principles. There are many other things under it, the 5S, and the value stream mapping and things like that. Predictive analytics. So we have been just probably going blindly to our department, working day in, day out. But do we know what all does actually happens in our department? Have we analyzed what is the inflow under each department? What are the resources that we have used for it? Once we start collecting data and then we start analyzing it, we are further able to predict it. Then we can know, especially in a high volume department, we can predict the possible intake of those patients under specific categories or specific departments. And we can modify our resources, or we can modify the human resource available in those peak hours. So this is predictive analytics. This is something that is picking up. And I would strongly recommend, as future leaders of emergency department, You must learn to pick up data in which happens in your emergency. There's a whole lot of data. It could be just like your door to needle time. What is that you have in your department? Is there any ways that I can actually improve it? What is the value map streaming that I can do? And then you want to predict certain things that is required for it and utilize the same. So this makes you stronger leaders in the emergency department. So these are probably what I would recommend as certain tricks in the emergency department. So I think I was quite fast. This is what I want to keep it simple and say, these are many innovations that are coming up in the gadgets and apps. India is speaking up. You just, and I think we all have these curious mind. So many of us have to actually become more curious and start considering innovations within your department and bring in small innovations that can actually make a big difference in your department. So thank you.